My father is a physician, and I grew up watching him and his effect on patients. And then when I was actually in the second grade, I got really sick with something called henoch-Schönlein purpura. I remembered at that time just how scared I was and how bad I felt. And, the doctors, it's a whole team, but, the doctors were coming in and they made me feel better. And so I decided that I wanted, as a second grader, to really be able to make that kind of a difference in somebody's life. Everything in the body, every organ system affects the lungs, whether people realize it or not. The majority of lung diseases are chronic. They're lifelong. You develop these relationships with your patients, and they truly do become like family. What I say to patients is that if you have COPD and it's more than just mild, if you are somebody who continues to have a cough despite multiple different types of treatment, if you are somebody, honestly, who has really any type of an extensive smoking history, and then if you just feel short of breath and nobody seems to figure out why, good old pulmonologist is there to help out, because there's a lot of reasons for shortness of breath. And then I actually even further subspecialize in something called pulmonary hypertension. So it actually deals with the vasculature of the pulmonary system, because the blood pressure of your body and the blood pressure in the lungs are actually two separate entities. The patient and I are a team, and essentially I'm like a glorified teacher. And I say that with all due respect to teachers, because I know I would not be here without them. I give them the tools, I share the knowledge, and I give them my advice, and I try to counsel them on what we can do together to improve their health. And can't always improve somebody back to normal. Unfortunately, many times can't, but trying to make their health and their quality of life the best that it can be going forward.